Hello everyone, my name is Dr. Aashish Chaudhry. I am head of the department for Department of Orthopaedics at Aakash Healthcare Super Speciality Hospital, New Delhi, India. Today I am going to talk about what is the procedure total hip replacement all about. So here I have a small, a plastic or artificial model just to explain this. Now if you see, most of the time this is the thigh bone, which is the femur, this is the pelvis, and this is how the hip joint moves. If you have no other choice and the patient's mobility and pain is very severe and mobility is significantly hampered, we have to advise a total hip replacement wherein the entire structure of the hip joint is changed with an implant. For example, if I tell you the components, so these are the two major components of the hip replacement. This is called acetabular cup, which actually goes and fits into the hole which is totally damaged or arthritic. And if you see this outside, it is the metal or the rough metal, which is an uncemented cup, and inside this white shiny structure is a plastic polyethylene, which gives a very smooth surface for the movement of the new joint. So this part, the acetabular cup, goes and gets attached here, and then the other part is the long stem, which you can see the rough surface area. So this stem goes and gets attached in the long bone femur. Now if you see this structure, this is the head of the hip joint. It is pink in color. This is actually a ceramic implant, so which is the longest running implant, has got the best wear capabilities. So this is the area which gets inside, and all the movements of the hip joints are happening on this particular articulation. So once we fix the stem here, once the cup goes here, all the movement of the new joint happens between these two articulations. And let me tell you friends, this is very revolutionary, and once we do this for a right indication, for a right patient, this can last the lifetime, at least for more than 2 to 3 decades. If patient takes the doctor's advice very well and takes care of the implant and carries out all his normal activities as prescribed, it's going to be a game-changing procedure for all the patients. Thank you so much.